Good afternoon, everybody. Thank you for joining us today for this health talk in the park. I have to tell you that I have a real fear of talking in public, and I'm screaming inside right now. But this cause of our health and our healthcare system is so important, I thought it was better to get over my fear. So, my name is Janie Brown. I'm a dentist with over 25 years of experience. I started my career at the Department of Health as a dental officer. I worked there for 6 years before transitioning into private practice. I've actually owned 2 private practices at this point, and I understand the dedication, the hard work, the work ethic, and the knowledge it takes to run a practice with a high level of care. I was chief of dentistry at the hospital at KEMH for 10 years. I've sat on the board for the medical staff committee and privilege review committee. I understand the challenges that both the Department of Health and the hospital have with patient care and with budgets. Bermuda needs to know that the health care isn't the largest expense in this country. It is our government. I want to discuss with you today the difference between universal healthcare system and unified healthcare system. This term has been thrown around by the Minister of Health for over a year now, and people seem to be incredibly confused as to what it means. I can tell you that those 2 words are not synonymous. So let's talk about it. Universal healthcare, which is also called universal health coverage, is a healthcare system in which all residents of a country are assured access to healthcare. As a healthcare professional, I, as well as all of my colleagues, want a universal healthcare system. We know that 90% of our residents already have access to healthcare through insurance, so we need to work on the 10% without health insurance. We believe we can achieve universal healthcare without dismantling the present system, which works. But we want to just make changes to make it better. So what would be the benefits of a universal healthcare system? All of our residents in our country would have access to healthcare, and more importantly, would have healthcare coverage. It would lower our healthcare costs, our workforce would be healthier, and we would have improved preventive care, emergency care, and health care. So let's talk about unified healthcare now. Unified healthcare means the government provides a single-payer health insurance to all residents in our country. They control the cost of premiums, and they control the services provided without competition from other insurance companies. All residents would be required by law to pay into the unified system. Most unified healthcare plans cover preventative care and emergency care, nothing more. All other health care procedures will be paid for out of pocket by patients or through expensive supplemental insurance. Your private health insurance coverage that you have right now will become null and void, as you'll be forced to pay into a unified system. A unified system that will most likely provide less benefits than you have now. So a unified system is really socialized health care, and this country needs to understand that this is the direction our government is taking us in. If this is what you want, then you need to know what you're going to get for that and what you have to pay for it. This type of system requires large sums of money to fund its success, which means heavy taxation through increased payroll tax, increased land tax, pension, or income tax. So what would be the benefits of a unified healthcare plan? Well, most of our citizens would have healthcare coverage. I can't say all. That same 10% most likely wouldn't be able to afford the unified plan any more they can afford HIP. You'll never lose your healthcare coverage even if you change employers, and you'd have increased preventative care and emergency care. So what do you think the disadvantages would be? Well, the first would be increased government revenue through taxes, and they would be heavy taxation. Elimination of consumer choice of insurers and other benefits of competition. You would have longer wait times for elective procedures and seeing your GP. Patients will most likely overuse the ER and see doctors more often, which means that it would be a stress to the system. Government may limit services with low probability of success. This includes drugs for rare conditions and expensive end-of-care life. And as the lady earlier said, even patients with cancer. So these are things that we have to be mindful of. Our government will be making those life-saving choices for us instead of allowing us to make them for ourselves. Healthcare costs can overwhelm our government and most likely will overwhelm our government's budget. And a unified health system does not equate to a universal health system. And this is something that everyone needs to understand. It doesn't mean that everybody will have universal coverage. What we want as physicians is universal coverage, however. So let's not try out a new system. Let's improve our current system by doing better. Say yes to universal health care and say no to monopoly insurers. Sign the petition and join Patients First.